Please allow me to formally start this digital dialogue with an introduction to our moderators. Dr. Jerry Gu is currently consultant in general surgery at Khoo Teck Puat Hospital in Singapore. He's also an adjunct assistant professor at Lee Kong Chuan School of Medicine, National Technological University, Singapore, and at Yong Yu Lin School of Medicine, National University of Singapore. He is a member of the National Trauma Committee of the Ministry of Health, chair of the Trauma Committee of Khoo Teck Puat Hospital, and a faculty for the Definitive Surgical Trauma Care course in Tan Tock Seng Hospital, Singapore. Joining Dr. Gu as moderator is Dr. Benedict Edward Valdez. Dr. Valdez is currently chairman of the Department of Emergency Medicine and head of the Emergency and Trauma Complex of Southern Philippines Medical Center. He is also a member of the Board of Directors of the Philippine Society for the Surgery of Trauma. Ladies and gentlemen, Dr. Jerry Gu and Dr. Benedict Edward Valdez.
Good morning, good afternoon, and good evening to our global active audience, and welcome to our 7th webinar in our series of interactive virtual encounters. Still, with our fighting journey through this pandemic, we are able to deliver our educational goals through a novel and virtual platform. And for this, we are thankful to a number of speakers and lecturers who have accepted our invitation as panelists, and to our industry partner, Escolap Academy, and of course to our global audience for participating and supporting our venture. The last 6 webinars were very well received, with almost 3,000 viewers, and this July webinar is no less, with almost 1,200 registrants for this evening. Friends and colleagues, the title for the webinar this evening is Conflicts in the Gray Zone, the Critically Ill Trauma Patient, a Management Paradox. Gray Zone conflict is a term used by the United States Special Operations Command to describe activities by U.S. state that are harmful to another state and are sometimes considered to be acts of war, but not legally acts of war. Gray zone in international parlance describes the space in peace and war in which state and non-state actors engage in competition. In the case of the critically injured trauma patient, it is the space between survival and death. In this space lies the management of the patient, which could be on time. Not one form of management is going to work exactly the same as another. For each team of critically care specialists, it will be different. Not one team is going to work exactly the same as another. It all depends on the needs of the patients. Therefore, it is a paradox. As Robert Frost once said, ends and beginnings. There are no such things. There are only middles. As long as proper management is on time, the possibility of survival of the patient is endless. We are particularly grateful to our distinguished speakers and eminent panel of reactors. Dr. Chris Bleeker from Netherlands, Dr. Louis Long, Dr. Jia Lim, Dr. Lowe Ling from Hong Kong, Dr. Ray Resurrection from the Philippines, Dr. Max Chin Chen from Taiwan, Dr. Jeff Inshong from the Philippines, and Dr. Kamal Jayasuriya from Sri Lanka. They will be properly introduced later. Moderating for the event today will be Dr. Benedict Edward Valdez from the Philippines and Dr. Jerry Gu Chung Chie from Singapore. Thank you, Ben and Jerry. Our sincerest gratitude also goes to the Scientific Program Director, Dr. Chuming Turk, as well as the Education Committee Chair, Dr. Amit Gupta, who had been the forces behind setting this collaboration and this webinar series. We would also like to thank the officer in charge of our secretariat, Ms. Riz Lynn Hickban. And I would also like to acknowledge with gratitude our industry sponsors for their generous support to this event, particularly Catedral and Huron Botanic. And of course, our sincerest gratitude to the painstaking team of B. Brown and Escolap Academy, who have provided the platform and assembled the whole shebang for this webinar. Thank you, Mr. Lee Chun Yong and the whole B. Brown team. The Academy of the Asian Collaboration for Trauma has 151 fellows to date, including those who will be conferred the title at the later part of this webinar. Once again, a very warm welcome to all of you, and hope you will learn a lot from this presentation. Thank you so much for your participation. Keep yourselves safe and well, and enjoy the active webinar. Thank you.
I'd like to call upon Professor Chun Meng Third, the Scientific Program Director of the Asian Collaboration for Trauma, for giving his closing remarks. Dr. Meng Third.
So when I was doing my fellowship in the USA many years ago, there was no trauma fellowship. Trauma surgeons did a critical care or equivalent fellowship. ICUs were managed by trauma surgeons in many centers. So trauma and critical care are intricately tied. There are many issues related to the severely ill patient, such as what if the trauma patient doesn't stop bleeding and you couldn't stop it surgically? What is the best way to give this critically ill patients nutrition? And how do we control their pain? And do we give antibiotics to these patients? We tried to answer these questions in this webinar. And for those of you who want to listen to these lectures again, or those who miss part of this webinar or who the whole of this webinar, will be posting these lectures online. But then it is never the same as listening to these speakers live. But then the webinar in August will be to commemorate the posthumous birthday of one of the founders of ACT. Four speakers will speak on the subjects dear to Appasamy Vijayan's heart. 4 reactors will react to their talks, and testimonials will be given. All this will be make a very interesting webinar. So, good night to some, good morning, and good afternoon to others. Thank you.